without this one substance, your blood sugar is not going to be under control. So whether you're diabetic or pre-diabetic, this is something that's really important for you to know as far as diet and lifestyle. So what I'm talking about is something called nitric oxide. A few weeks back I talked a lot about it, but I didn't talk about it in relationship to blood sugar and diabetes, so I want to do that now. Nitric oxide is pretty fascinating because it's a gas, and so you eat foods with nitrate, your body turns it into nitrite, and then you make nitric oxide. And again, it's a gas that lasts for a fraction. That wasn't very good. No, still not. Okay, not a good snapper. It lasts for a fraction of a second is what I was trying to show by snapping my fingers. And so it doesn't last very long at all, but it doesn't need to last because it's like lighting a match. If you light a match and then you light up something, that's what nitric oxide does. So then you can blow out the match in a second. As long as you've lit what you want to light, then it didn't have to be around very long. But of course, it needs to light up a lot of things, nitric oxide, because it has to do with circulation, it has to do with protecting your brain, it has to do with diabetes. We'll talk about that in a second. But it's really critical for life function across all parts of the body. It affects everything, because when you think about circulation, where do blood vessels go? They go everywhere, right? So when it comes to blood sugar levels, what you want to do is when you eat something and your blood sugar rises, then your body produces a hormone called insulin, and the idea is that insulin will then drive that glucose, that blood sugar, into your cells to be used for energy. But it requires something called GLUT4. So that's GLUT4, which is glucose transfer. That's what it stands for. It's a glucose transporter, number 4. Not sure where the number 4 came from, but that's what it's called. So this is a protein, and your body requires it to get that glucose. It's that last step to get that glucose into your cell, which is really important. So if GLUT4 is not doing its job, then you have this high circulating level of glucose and perhaps insulin, and this is not consistent with good health. So it turns out that this GLUT4, in order for it to do its job, is dependent on nitric oxide. So pretty fascinating, all the things that are dependent on nitric oxide. So where do we get it? We get it from eating nitrates, and so they talk about dark green leafy vegetables like arugula and spinach, red leaf lettuce, but carrots are on that list, and what else is on that list? Cabbage, kale, carrots, pomegranate. So it's not just dark green leafies, but an assortment of good vegetables that are on that list that raise your nitrate production. So again, the nitrate turns into nitrite, and then it's turned into the nitric oxide as you need it. But you need a lot of it because it keeps your blood vessels healthy. And you make nitric oxide from the good bacteria in your mouth, the good bacteria in your gut. If you follow this channel at all, you'll know that gut health is not something we Americans, unfortunately, are raising our hands, spouting that we have great gut health, because we do not. So you need the good bacteria in the gut to help produce the nitric oxide, and there's a lot of lifestyle issues that diminish that. We talked earlier about mouthwash is a bad thing. PPIs, proton pump inhibitors, the form of antacids, annihilates your nitric oxide. I just learned today that NSAIDs, like Aleve, is another medication that really compromises the production of nitric oxide. If you just take the antacids and NSAIDs, which are pain relievers, that's a lot of Americans. Those are two of the most common drugs that Americans use. So we are really compromising our nitric oxide. And again, that's compromising our ability for our blood vessels to be healthy. So it's resulting in high blood pressure, erectile dysfunction, both male and female, dementia. What else was on my list? And of course, diabetes that we're talking about. So the Diabetes Association, once again, is you have to have that blood sugar going into your cells and then fueling your cells. And without enough nitric oxide, that passage, that mechanism is just not happening the way it should. So what's the moral of the story? Eat more dark green leafy vegetables. As I said, there's a little bit longer list of the vegetables. They're not all dark green, but they are vegetables. And, you know, Americans are not very good at that. And it's the number of times that issues that we talk about come back to diet and not consuming enough vegetables and enough healthy fibers. That's a common thread. Boy, if we just did that, we would be doing so much better. But there's some exciting news about nitric oxide as a gas. I can only, you know, you can only imagine you're studying a gas that's, you know, oh, that was better, gone, you know, in a millisecond. And, you know, less than a second, it's gone. How do you study something like that? But some brilliant scientists have been literally working on this for decades, and they have not only realized the mechanism and diet things to do as far as what we've just talked about, and then not do the mouthwash and avoid the antacids, avoid the NSAIDs, but also a supplement. So it's very exciting because there have been some supplements that have come out in the past that were said to should lead to increased nitric oxide production, and they actually didn't. So I'm going to do a whole separate episode just on this supplement. I've been playing with it for the last 3 weeks, and I can actually tell a difference. So it's very interesting, and it's very well documented. These are literally scientists, as I said, who've been working for decades on trying to figure out how to enhance our nitric oxide production, because the issue is that the nitric oxide we make within the cells of our blood vessels, after the age of 40, it's decreased by 50%, and it just goes down, down, down with each passing decade. So that's problematic. And then also not having good bacteria in our mouth because of mouthwash and bad toothpaste and fluoride, and then not having good bacteria in our gut because of our poor diet. So there's so many ways that unfortunately we're hitting at that nitric oxide production. We need a workaround. We absolutely need a workaround. And of course it's a great idea to eat those fruits and vegetables that I just mentioned because there's so many benefits. But if you're already in this diabetic, pre-diabetic, high blood pressure, you've got erectile dysfunction, you've got dementia or brain fog. There's so many conditions where nitric oxide touches how you're feeling. Think about just circulation, kidney issues, eye issues, all the secondary effects of diabetes you look at, right? Kidney disease and eye disease, and also neuropathy, so not getting good circulation to your extremities. So the circulation is critical, and this nitric oxide production is very critical. So I'm going to do a separate live on this new supplement because it's very exciting. But I wanted to give you the information about diabetes because if you're someone who's really having trouble controlling your blood sugar, and there's a lot of drugs out there, yet a lot of patients are taking their medication and their blood sugar is still out of control. So a lot of it has to do with quality of diet, but this could be an added boost for you to get that blood sugar under control, because diabetes is a terrible disease, and it's married to heart disease. So where there's diabetes, there's typically heart disease and vice versa. So if you enjoyed this content and you got something out of it, please give it a thumbs up and subscribe to the channel so more people can learn about this.